So my country of choice was Australia, who is a part of the International Federation of Dental Hygiene. So before we talk about Australia, I'll introduce you guys a little bit to the IFDH. So it was formed in Norway in June of 1986. It is a non-governmental and non-profit organization, so no religious, no racial, no political ties whatsoever. So it basically unites dental hygienists from around the world in their common forms of dental hygiene practice. The way that the IFDH is set up is that it is kind of governed by a House of Delegates. So 2 delegates from each country that's a member makes up the House of Delegates, and they meet every 3 years to discuss and plan for different techniques, different focuses, different educational topics in the dental hygiene world that they want, to discuss or get out. So they also have a board of directors in the IFDH. So there's 5 members that make up this board of directors. Is the president-elect, the secretary, treasurer, and vice president. So they are responsible for the execution of the goals that are set forth by the House of Delegates that we discussed about a minute ago. There are 2 associations in Australia that are a part of the IFDH, and those are the Dental Hygienists Association of Australia and 2 the Australian Dental and Oral Therapists Association. In Australia, the dental team is made up of a dentist. They have dental prosthetists, dental hygienists, dental therapists, and dental oral therapists. Dental oral health therapists. Dental hygiene is very, very, very similar in Australia as it is in the United States. There are some differences which we'll discuss, but as far as education, you do have to be licensed, so you do have to take the board exam. You have to have a minimum of 2-year full-time schooling, or you can do a dual qualified minimum 3-year full-time education program that is approved by the national board. But at very minimum, you have to have that 2-year degree in training and then get your license by passing the board. Again, the scope of practice is very similar as it is in the United States. They provide oral health assessments, diagnostics, treatment, management, and education for the prevention of oral disease and to promote healthy oral behaviors to patients of all ages. So this scope may include periodontal or gum treatment, preventative services, education, or any other oral health care. This is where it's a little different than it is here in the United States. So their dental hygienist team or scope is made up of, there's 3 positions. So there's your dental hygienist, your dental therapist, and your oral health therapist. So your dental therapist is gonna not typically treat adults. So they're going to focus on children, adolescents, and young adults. Dental therapists, under their scope of practice, they are actually allowed to restore decayed areas and extract teeth under local anesthesia, which dental hygienists, we know in the United States, cannot do that. And again, these dental therapists are usually going to work in the public setting. which the dental hygienists are going to normally work in the private settings and focus more on adults and their health care. With healthcare therapists, they are going to be a combination of the both. So they're going to really do the younger age and the older age, but with an oral health therapist, you do have to have a bachelor's in science in oral health to have that position in Australia. So, as we said before, the dental hygienists are normally going to work in private settings, and they're going to be mostly concentrated in the major cities of Australia. Very few hygienists work in the country areas or rural areas or public sectors. You're not going to find that much. There you're going to see more of the dental therapists, and that, as we said before. So there's two organizations that oversee dental hygienists and dental therapists in Australia. They are the AHPRA, which is the Australian Health Practitioner Regulation Agency. So they really help in the conjunction with the board exam and dealing with that type stuff, signing up, passing, and regulations with that. And then you have the Dental Board of Australia. So that is supported by the AHPRA, but that is going to regulate the dental practitioners. The whole, working part of it, not really dealing with a lot of the board exam as the AHPRA is. So yeah, that really does it for Australia, and so we know the differences with the main differences with the dental therapist that they have there, which was really cool to learn about because I didn't know that. So that was probably the most interesting thing. Other than that, I didn't really read a lot of differences in Australia, so that was really cool to learn. Thank you. And here is our works cited page.